Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond takes a look at restaurants during the pandemic, how some have closed, how others have pivoted to serve takeout customers, and what the future may hold for dining out. She talks to two people in the Baltimore restaurant scene, Barry Yanowitz, a bartender at Brewer's Art, and Carlos Raba, an owner of Clavel. Let's listen.
Barry and Carlos, thank you so much for joining me.
Thanks for having us.
Thank you for having us.
So you guys have two different stories to tell about the restaurant industry and the lockdowns associated with the coronavirus. Here in Maryland, it's been about 2 months since bars and restaurants were ordered closed by the governor. Barry, you work at Brewer's Art. Tell me a little bit about how things have happened in your world in the last 2 months.
So Volker Stewart, the owner of Brewers, proactively closed us on the day that Governor Hogan announced the mandate. He saw it coming. He figured it'd be a day or two at max. It turned out to be the same day. And he did it in the interest of our health, the staff, our patrons' health. Things were changing rapidly, as we remember. No one had any sense of how things were going to change, how long we'd be closed for. We didn't know as much about the virus or its transmission. And our ability to pivot or transition was limited. We don't have the infrastructure for it. We didn't do takeout or delivery beforehand. Our menu doesn't easily lend itself to it. So we didn't have supplies on hand for takeout. We didn't have relationships with delivery services or our own drivers. Our space isn't great for waiting areas. We have a quirky old mansion as a building. Things like, we make beer, we're a brewery, but we don't have growler fill stations. During regular service, we fill growlers off the taps. We don't have a crowler machine. We don't can on site. So we can't just transition to that. So we shut down entirely. We have a pretty big staff as we waited to see if it would be 2 weeks or longer. And once you're shut down, reopening has different challenges, much bigger challenges. Your costs go up, your operational costs, the same things that you have during normal service. You have food costs, higher electricity bills, your labor costs, et cetera. So we closed, and we decided so far to stay closed until we get a better sense of what's going to happen.
And Carlos, you guys did something a little different. Tell me about what's going on at Clavel.
So yeah, we closed the day of March 16. That's when we sat down and actually look at what was going on. And then we were at the same pace that we didn't know what was going on. There was not a lot of direction. But the circumstances is that we have 65 plus employees in Clavel. So it was responsibility of how we continue providing services safe for the environment, safe for the employees, and safe for the community, and still be essential. So we totally pivot to change the menu 100%, change the systems of packaging, and starting reinventing, rethinking, and brainstorming of how we're going to take care of people in 48 hours, how we're going to compensate the people staying at home, how we're going to compensate the people working for us, because they are the ones coming to work and being essential to our community and to the business, so we can have a Clavel for the future. So it was writing a business plan on 48 hours. It was very stressful. I imagine. It was very hard for myself and my business partners, and still is, because it's on a day-to-day basis that you're making decisions, and you're making decisions that you affect a lot of people. And I mentioned the uncertainty of what's going on or what's next is hard. Like we have right now, there's the stuff that I'm struggling today. They're not the same struggles that I had the first week. And then you see a pattern of the struggle with food supplies, people too, how people feeling. So it's a total different system and a different business that we run now.
Mm-hmm. And so you have converted to a takeout operation.
So yeah, we did PC Core, and how it works is that we have the facility that facilitate that. We have a street that is not too busy, and then we could put with cones and not have the contact with people, stay away from people. Also through that we put a 20% increase on an oral pricing, and that 20% went to take care of people that they stay at home because not a lot of people get help from the government. You didn't know when the people were going to get the help from the government. So the 20% increase went to a pool that it was distributed to everybody staying at home, and a percentage to the people who come in so they earn more money for coming to work than the regular that they earn. So like I told you, it's a whole different system and different business that we're running.
And the goal, it seems to me, from what you've told me before, is that basically to keep your employees whole. This is not a money making operation. This is to try to get money to your employees.
Yeah, one of the first things that came into our mind is essential, being essential, and being and me and Lane, we are really big into community. I have a nonprofit, GM2, next to Clavel is like, how can we become essential? And that's the way to do it, taking care of your people and knowing that they making a sacrifice by coming to work, and also taking care of the community because you make a difference with putting food on the table. Regardless if they pay for it, it makes you cozy, it makes you feel at home, and it gives you a little bit of ease at home. So it's also a community service. We packing around 300 burritos for the hospital right now too, and they come and they pick it up. So yes, we are essential. We need it. It's different circumstances with different restaurants, but yeah, we're trying our best.
And Barry, talk to me about your restaurant in terms of it's a community, right? And I guess a lot of restaurants are sort of communities. And that not only are you unable to sort of to feed the community, but I know there's a lot of people who spend a lot of time there, your regulars. What's it like without that?
Oh, my regular. There have been so many people who have had so many genius things to say about the role of the bar or the restaurant in the community. I've read a lot of them recently. I've made the joke often that my job, the most amazing, most gratifying thing about my job, a substantial portion of my job is hugging people. I hug people all day. That's what I do. I make drinks. Yes, I pour drinks, I pour beers, I shake up cocktails, but really what I do is hug people and talk to them about their lives. I know so many people personally through that bar. Our community of regulars, I mean, Brewers has been in business 24 years this year. We have hundreds, thousands of regulars. Some we see daily, some we see weekly, monthly, yearly. Their lives have changed over the last 20 years too. Today, literally 2 hours ago, I spoke to one of my dearest regulars, a man named Dennis, who's in his early 80s, still working, works for the state actually, and just chatted and caught up. I hadn't actually gotten a chance to connect with him. And, we just talked about his grandkids and, his daughter, who's a professor in Texas and is, trying to hold classes on Zoom. These are the people, I mean, we share their lives with, our daily, day in, day out lives, but also their lives. I mean, the amount of people that in Mount Vernon that pop in just to have a beer to unwind at the end of the day because they don't feel like cooking, because they need to get out of their house with their child, many of whom, are regulars also. We've had, in 24 years, we've had countless relationships built at Brewers. I mean, that's the thing. People use us as an extension of their living rooms. We're their meeting place. This is where they come to mourn, they come to celebrate, as they transition through various things in their lives, graduations, weddings. That's what we see all day, day in, day out. And that's the type of community that supports us and that we support.
And it's lost right now.
It's lost. There are Zoom calls aren't the same. Happy hours virtually are not the same. However, they're helping make you feel like you're connected and staying in touch with the people who you care about. For many of us, especially those who've been at our places of operation for multiple years. I mean, I've been at Brewer 6.5 years now. These are friends, a number of them are personal friends. There's a weekly happy hour for a group that is in a choir that practices down the street. And they come in usually once a week, every Tuesday or every Thursday. But I've joined their choir Zoom call just to say hi and catch up and see their faces and have them, kibitz basically and chat about how they're coping. We have it. It's not the same as being next to somebody, hugging somebody, being able to shake their hand, serve them something, from my hand to theirs.
Carlos, I know that in Barry's case, she's been furloughed, so she's able to receive unemployment. In your case, have your employees, some of them been furloughed, some of them still on the payroll?
So yeah, you have some of them right now. So right now we went through a PP loan, so we have right now people working, and we have people through that, and we have people at home too getting their help. And what I have heard that some of them are getting their checks too, but we're still supporting the ones that they cannot receive help. So yes, it's a constant communication between our manager Carolyn and the staff that is at home, because most of the staff right now, because the system change, what you see the impact is the service people, the servers, the bartenders, because that's what's missing right now. I have probably 80% of my kitchen working, which is 8-9 people that I have scheduled, and is providing burritos and making salads and making the piscicole run. But as we were talking, is it's not the same, and I think is right now my struggles, like I would tell you, is like a pause. 7 weeks ago, the food industry hit a pause. So right now, the struggles that I have is getting pork, getting meats, getting some supply of vegetables. So it changes every day, but yeah, it's people. We taking care of people since day one. It's been our focus. It's not making profit out of this, but yes, the answer is yes. We're trying to take care of people, and we're doing it.
And I understand that you run into the same struggles like that I do as a home cook, right? I go to the store and I really want to bake bread, but there's no flour. I mean, are you running into those same kind of troubles?
There's a lot of troubles right now. For example, my day tomorrow is going to be wake up at 3:30 in the morning because I need to go and pick up supplies, meat. I need to pick up from the butcher, because the butcher cut his staff in half, and he cannot deliver at 6 in the morning like I was, and so I have to be now the deliver guy. So you have to keep your eye open on pork, the availability of milk, the availability of the first week. It was a milk issue. You couldn't get milk, orange juice, some vegetables. But now I see a bigger change. We very happy to support local farmers like Little Chicken Farm that she provides eggs. Like the first week it was like, I don't have eggs, but right now I guess to a pause is like, okay, slow down, it's back to normal. So it's really who is getting affected and how it's getting affected. And I think the meat industry is gonna have a big effect in this.
Are you looking forward to the day they say you can reopen? How will things look then?
Uh, well, yeah, so I think our business is going to change. He already changed, and he's going to change more, and he's going to change on a daily basis. It's going to be hard. I think at the beginning it's going to be really hard for bars, and for example, for myself, I have a kitchen bar and a regular bar. We're going to see what the government does and what are the restrictions, and really think about it, because there are restaurants like Clavel, Brewers Art, that they strive of bringing people together, and that is the whole concept of Clavel, bringing people together to enjoy our food, our drinks, our space, and commingle. Okay, since the beginning, me and Lane thought about the whole focus of Clavel is having fun, sitting on a communal table. So are you changing your concept, or what's coming next? You know what I'm saying? So yes, it's challenges, but that's where you need leadership and people sitting down and really open conversations to see what is next, what is the next phase of Clavel, because we don't really know when it's going to be the real Clavel again. You know what I'm saying? So you have to have this change of business and ideas every day and every week.
And Barry, I guess it's hard to sit at a bar 6 feet apart.
It is. We're not even sure we're going to have bar seating. I mean, a lot of people across the country are trying to strategize on how do we reshape our existing restaurants with their existing physical spaces and their existing table layout to accommodate what's people's concerns going forward about being in close proximity, the guidelines that we don't have yet from the government, from industry sources. There's a lot of planning that's going to have to take place in the next couple of weeks as we get closer to reopening.
Well, I look forward to coming to both Brewers Art and Clavel to meet you in person once this is all over. Barry Yanowitz and Carlos Raba, thank you both so much for joining me.
Pleasure. Thank you for having us.
Thank you for having us. Appreciate it.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.